Hormone replacement therapy is considered the most effective way to help women with menopausal symptoms, but risks of developing other problems have some women looking at alternatives. One alternative is using bioidentical hormones derived from plants. Lurene Cachola has more on this type of treatment and whether it's a safer alternative.
As we reported on Smart Medicine in 2013, a long-term study on hormone replacement for menopausal women reported that there can be a higher risk of heart attack or breast cancer for women getting the replacement hormones. That led to some women stopping their use of estrogen and progestin, but seeing their symptoms return. Other women continued using traditional hormone replacement therapy, or HRT.
The more traditional approach, the one that's the best studied, are your FDA-approved hormone replacement therapies. These come in gels. They can come in pills. They can come in patches. They can come in creams. But they're all chemically made and commercially available.
Some women have turned to an alternative form of HRT, what some call natural or bioidentical hormone therapy. These bioidentical hormones are not produced from chemicals, but are made from a plant substance taken from yams and soy that is supposed to be identical in molecular structure to hormones produced by women's bodies. Dr. Highnote, who has patients using bioidenticals, says they are created to be specifically based on a woman's body chemistry. Women using bioidentical hormones are referred to compounding pharmacies, which use saliva testing to measure individual hormone levels, then specifically make a cream or tablets tailored to women's hormone deficits. But unlike FDA-approved hormones, bioidenticals don't come with so-called black box warnings that alert users to risks.
But there are some warnings to be heeded with that. One of them is the bioidentical hormones, many of them don't go through FDA approval. And so while they don't have black box warnings on them like our estrogen does and our commercial products, it doesn't mean the risk isn't there. They just don't have black box warnings because they don't go through FDA approval.
Highnote says the mindset in treating menopausal women is to identify their symptoms and give them the least amount of hormone necessary to control their symptoms and give them a good quality of life.
In terms of the dosing, that's where it gets a little different because, your FDA products are going to be set doses.
It may take trial and error to find an effective dose, but Highnote says using conventional pharmaceuticals can be a simpler and less expensive way to treat menopausal symptoms.
I do have patients who have tried the FDA-approved products for a good period of time, maybe 6 months, maybe a year. And that's where I think it's appropriate and fine, as long as they understand the risks, to say, well, let's try compounding. Compounding may be a better fit for you.
She says that can be the case if a woman suffering only hot flashes needs a progestin cream to manage that problem. However, doctors say it's important to note that the method of manufacture does not make one type of hormone safer than another.
So the risk is still there, and I just worry sometimes about patients thinking that they're taking bioidenticals because they're safer, because they're not safer. I think it could be fair to say it's an equivalent risk, but it's not less of a risk.
For Smart Medicine, I'm Lurene Cachola.